Could you tell me what the status is of the U.S. bishops on in regard to the Catholic Health Association in terms of the new healthcare bill?
Well, we were pretty forthright in our concerns with the legislation that was passed by Congress to our opposition. We opposed the opposition. We opposed the healthcare bill because it did not provide adequate conscience protection. It did not, in spite of what its proponents allege, it did not keep money from going to fund abortions, and it also left out undocumented aliens from any protection or any possibility of health insurance, even if they were willing to pay for it themselves. So the bill was flawed, and we thought that the administration could have addressed our concerns and still have had a bill that they would have been happy with. As it is now, we are very concerned for the future, and unfortunately, I think the Catholic Health Association, probably they had more to fear from the government than they had to fear from the bishops, and so it was not a profile encouraged moment for them.
And do you think, just one last question, do you think that the bishops of the United States should have a full voice on the moral content of legislation?
Well, of course, just because we're bishops doesn't mean that we are second-class citizens. We remain citizens of the United States of America, and as such, we have every right to participate in the public square. And as church leaders, we also have a voice that we want to be heard in the public square. Again, oftentimes, people will criticize us as if we are trying to impose our views, and of course, as even Stalin recognized, the Catholic Church doesn't have an army or a police force to impose our views on anyone. But we do have a proposal to make, and we have a word to share, and we would be remiss in our duties as teachers of the faith not to witness to that word, and to make our proposal as to what constitutes the necessary conditions for human flourishing in American society.
And any further comment on the health issues? Some further steps to take?
Well, again, we would certainly be very much in favor of the administration going back and fixing what we still think are very flawed parts of the healthcare legislation. Now, we at a Bishops' Conference for 40 years have advocated for healthcare reform, but we weren't willing to go for healthcare reform under any conditions. Basically, we have said that healthcare reform means that it should be accessible to everybody and nobody should be killed. And this Obamacare does not make it accessible to everybody, and it allows for people to be killed, namely unborn children, at the government expense, taxpayers' expense.